Good morning, honorable members, ladies and gentlemen. This sitting is now resumed.
Madam Deputy Speaker, revert to orders of the day.
Permission has been granted.
Thank you, Madam Deputy Speaker. We have accumulated to date 36 hours and 46 minutes as of yesterday in the process of the estimates debate. There is one more head scheduled for discussion this morning, which is the head of Ministry of Health and Wellness. I am mindful that the standing orders, Madam Deputy Speaker, provide for us to entertain a maximum of 40 hours for discussion on these heads, and also that each head is allocated a maximum of 6 hours. As such, I anticipate as well that this head of Ministry of Health and Wellness is likely to go beyond the 6 hours, and clearly we're likely to exceed the allotted times granted in the standing orders. I therefore beg to move the suspension of standing orders 66-1 and 67-2 for the remainder of the sitting.
I beg to second that.
All those in favor, please say aye.
Question.
The question is, the standing orders be suspended for this sitting to facilitate the extra hours required. All those in favor, please say aye. Aye. Those against, please say no. We think the ayes have it.
Revert to government business.
Government's business is resumed. When the sitting was last suspended, it was in Standing and Finance Committee, and to that we shall revert. And to that we shall revert.
This Honourable House is now in Standing Finance Committee. Honourable Member for St. Michael North.
Mr. Chairman, I crave your indulgence and permission to allow the honorable member from the other house, Minister of Health, to join us in the well to present the estimates.
Permission granted.
Mr. Chairman, Head 86, Ministry of Health and Wellness, in the amount of $236,347,534.
Honorable Minister, you have 10 minutes to give your overview of the ministry.
Good morning, Mr. Chairman, and all honorable members of Parliament. This morning, I'm accompanied by a number of members of staff. To my immediate left is the Permanent Secretary, Mr. Wayne Marshall, the Chief Medical Officer, Dr. Kenneth George, Dr. Arthur Phillips, the Deputy Permanent Secretary, Mr. Wayne Webster, the Director of Planning and Research Unit, Mrs. Rashima Cheltenham-Niles, the Chairman of the Board of Directors of the Queen Elizabeth Hospital, Mr. Nigel Whitehall, the Chief Operations Officer of the Queen Elizabeth Hospital, Dr. Christine Greenidge, the Director of Medical Services, Mr. Anthony Harris, the Chief Environmental Health Officer, Miss Francine Bascom, the Manager of the Psychiatric Hospital, Mr. David Leacock. Mr. Chairman, I thank you for giving us the opportunity to present on the work undertaken by the Ministry of Health and Wellness over the past year and to outline some of the plans for the next financial year. Our estimates recognize the fact that there are a number of challenges in the health sector that need to be addressed. These include the recurrent issues at the Queen Elizabeth Hospital affecting the delivery of healthcare at that institution, the scourge of NCDs, while we seek to reduce new cases by 50% by 2030 as part of our mission, the reform of our mental health system while monitoring new and re-emerging infectious diseases, and the global threat of AMR, the need to upgrade our polyclinics as we refocus on primary health care, and the absolute necessity to strengthen our health information system while paying attention and preparing for the climate-related health issues. So I'm pleased to report that despite the aforementioned challenges, there have been several initiatives in the Ministry of Health and Wellness, both at the policy and programmatic level, which we have implemented and will continue to implement more in the next financial year. The ceiling for the Ministry of Health and Wellness this year was capped at $355,734,764. And the approved budget for that was the approved budget for 23-24. The Ministry of Health and Wellness new total for the draft estimates for 2024 to 2025 is $317,149,901. The reporting period was the first year, Mr. Chairman, that non-communicable diseases program had its own budget, separate from health promotion. The allocation of dedicated resources enabled an advancement in work across cancer and cardiovascular risk reduction, as well as childhood obesity. Initiatives included the development of a colorectal cancer screening project and training of trainers in self-management of NCDs. A partnership with the World Health Organization resulted in the hosting of the Small Island Development States Ministerial Meeting during the 14th to the 16th of June last year. The Ministry of Health continued to address hypertension and associated factors, given the position of cardiovascular disease as the #1 cause of death locally. With support from PAHO and the Heart's Cardiovascular Risk Reduction Program, was strengthened across all polyclinics and introduced to the private sector to better control hypertension and the resulting cardiovascular morbidity and mortality. A wider national nutrition policy was drafted in collaboration with the Ministry of Agriculture and Food Security and other stakeholders. And this document builds on the school nutrition policy and provides a wider basis of interventions across the population with major nutrition issues. The ministry continues to purchase services from Heart and Stroke Foundation, the Barbados Diabetes Foundation, and the Barbados NCD Register to ensure the availability of cardiac rehabilitation, specialist diabetes care, and monitoring of cardiovascular and cancer outcomes. We've also engaged partners in creating a screening protocol for breast cancer, and PAHO has facilitated the creation of a cancer risk reduction messaging focused on the leading cancers. The colorectal project, in addition to developing guidelines to improve colorectal cancer screening, the ministry has created an initiative that strengthens screening by allocating resources to enhancing laboratory capacity and